CJSON podcast listeners. I'm Sam Silver from Queen's University, here with co-author Ziv Harel from the University of Toronto to discuss our meta-analysis on the effectiveness of various strategies for quality improvement for managing chronic kidney disease.
We were motivated to perform this study because similar meta-analyses in diabetes, hypertension, and heart failure have shown significant health benefits with quality improvement interventions. We wanted to find out if patients with chronic kidney disease also benefit from quality improvement strategies.
Our search strategy included randomized controlled trials because these studies tend to be of highest quality with rigorous methodology. We required quality improvement strategies to target the patient, healthcare provider, or healthcare system, and study outcomes had to be clinically relevant.
Our study only included adult patients with non-dialysis dependent chronic kidney disease, and transplant patients were also excluded.
We identified 15 patient randomized trials and 6 cluster randomized trials. We found that quality improvement interventions had significant beneficial effects on 3 elements of chronic kidney disease care: dialysis incidence, LDL cholesterol concentrations, and the use of ACE inhibitors or angiotensin receptor blockers.
We did not observe improvements in mortality, cardiovascular events, estimated glomerular filtration rate, glycated hemoglobin, and systolic or diastolic blood pressure for a few reasons. These included study heterogeneity due to different patient populations and durations of follow-up.
We're also a little disappointed by the low number of studies that have been done and their adherence to quality improvement principles.
The low study number prevented us from identifying which quality improvement strategies were most effective.
We also observed that the low adherence to quality improvement principles was related to few studies assessing adverse events, patient experiences, and healthcare provider feedback.
Only 5 studies reported the proportion of the time that the intervention occurred as intended, known as fidelity. Failure to achieve high fidelity makes it difficult to determine whether a negative study is due to poor implementation of an effective intervention or an intervention that is inherently ineffective.
While quality improvement strategies may be effective for patients with chronic kidney disease, it is hard to recommend a specific quality improvement intervention given the limitations of our study.
What is currently needed are more rigorously tested quality improvement interventions in nephrology tested on a small scale to ensure fidelity, efficacy, and satisfaction before evaluation in a large interventional study.
In addition, the changes should target the healthcare system instead of individuals. There are lots of quality improvement resources out there to help, such as those from the Forum of ESRD Networks and the Institute for Healthcare Improvement.
That's it for now. Thank you all for listening.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.